is there weight gain is the reason for the low back pain as well, sir? Or low back pain? What's the most common cause in your practice?
So I'm going to be very brutal, right?
Yes, please.
If you're above 6 feet, man or woman, and your waist is above 34, you are going to have low backache. Okay? If you're below 6 feet and your waist is above 32, you are going to have low backache at some point of time. Because we do not have any bones from the zippy sternum onto the pelvis.
From here to here.
Yes. But we have 4 layers of muscles there. And these muscles, which are called the core, have the ability to be as strong as a bone and flexible as a muscle.
In this part.
Yes. The reason why we get low backache is that when we do some activity, we are not able to maintain intra-abdominal pressure because your core is weak. And so you breathe out in a wrong manner. Say you're lifting something, you bend down and you lift it up. You don't know to brace, hold your core inside. So the impact goes on the disc. The disc slightly tears or slightly bulges out. And then what happens? You take rest. When you rest, muscles start to waste, further stress. And when you're in severe pain, you start to eat more, you gain weight. So if you imagine the skeleton, right? There is an upper body which ends at the ribs, the lower body starting at the pelvis. In between, if you see, there is just 5 lumbar vertebrae. If you actually take our skeletal system. Because when we evolved or God created us to be erect, He was smart enough to think they also need to bend. So let them have a soft middle.
So that's why L1 to L5 is your back.
Yeah.
Low back.
Yes. And it has discs in between. That's why upper back pain is quite rare. Because we have the rib like a circle here. So if our core was really strong, it would be like a bone when we are erect or lifting weights, and it would become soft when we are bending down.
I see. Is posture also makes, like sitting on the computer, bending down, will that?
Absolutely. So again, posture is involuntary, right?
Involuntary.
Yeah. You can't, yes, you can correct your posture, but depending upon the tone of your muscles and the balance, when you are really not focused on your posture, you either lose it or it maintains it. It's called activation of the muscle without voluntary control.
So unconsciously, in the subconscious mind, we just go slouch.
Yeah.
So do you recommend to just keep a timer or something and then?
No, I recommend that you start doing exercises for your core, like planks, farmers carries, carrying weights on the side, good posture, core tucked in, functional core exercises, stuff like that.
And they can do that even when they are big, or they need to lose weight and then do it?
No, they can. Everybody has to do it. Everybody who wants to stand erect and also bend down to do stuff has to do it.
Okay, so come in the 20-minute period that you're talking about.
Yeah. And also, let me tell you, it's not ideal to use your spine to bend down. You have to bend down with your knees. But still, I bend down because I need some flexibility of the knee, of my spine also, right? So in case there are a lot of exercises where you bend down, that's a necessary movement. So in case you have to do that, and you shouldn't get an injury, you have to have a strong core and back.
What is the treatment for low back pain then? What do the people do after losing weight?
So the first thing I say is reduce added sugar and reduce any processed foods because it increases your inflammation. See, anybody who's having a lot of added sugar or processed foods, their ESR CRP, which are the signs of inflammation,
marker.
are more or less always elevated. It's not like really high, but it's always elevated. Next thing is see a physiotherapist. Okay, start yourself on stretches and exercises, basic exercises for your back, your core, stuff like that. Third, start losing weight. Losing weight is extremely important. Fourth, focus on your sleep. Once you do these 4 things, and also with some medications, okay, massages, stuff like that. See, I have seen a lot of my patients improve by just giving them confidence that it will improve. Yeah. So I prefer not to remove the disc without doing a lot of interventions.
I see.
Every surgeon is trained differently, right? I was trained in order to focus on losing weight. The reason is that you remove a disc from one level. If they haven't changed their habits, it is going to happen at the
Next one.
other levels also. That is one. Second is removal of the disc. It can be done endoscopically, okay, where you don't remove the bone, just the disc. But a microdiscectomy would be removing a part of the bone in order to access the disc and push the nerve down. Okay? So
the back pain is because the nerve is being trapped in the disc?
Yeah. Back pain is primarily because of inflammation of the disc. Sciatica is because of compression of the nerve coming out from L4, L5, S1. That causes the radiation. So for 6 months, you've done your lifestyle modification, weight loss, changed your diet, physio, you're regular with exercise and your medications. For 6 months, if you continue to have pain, then there are a lot of interventional options. Interventional options are physiological pain blocks. It's a new technique where we treat the pain distal to the source of the pain.
I see.
Using injections done under local anesthesia.
Wow.
That's a method. Then we have nerve blocks, median nerve blocks, facet joint injections. There we give PRP in those areas. Then we have intradiscal procedures where we don't open, we go inside the disc, remove a part of the disc, or we ablate the disc, or we inject ozone into the disc, things which shrink the disc. Yeah. And if all these don't work, then we do an open surgery or an endoscopic disc removal.
I see. Besha, what are you telling me? It is better to prevent any kind of problem rather than treatment.
Absolutely.
Of low back pain.
Absolutely. And it is also better for us to identify what are the habits which caused the low back pain. Because surgery is an intervention. It's an intervention of the problem caused by certain triggers. It's not an intervention of your habits or your triggers. Everybody should understand. Why did I get low back pain again after surgery? Because the surgery was to intervene a complication caused by your habits. That has been removed. Your habits, if they are still the same, you are bound to get the same complication at the next weakest point. That's why weight loss. That's why strong core. That's why eat healthy. That's why. See, the thing is, if you stop eating processed foods and sugars, your craving stops.
Yes. Slowly.
Yeah.
Slowly but steadily, but
Yeah.
still happens.
Yes.